Last week, I examined a patient with anemia. The patient was found to have a reduction in her red blood cells and hemoglobin. She was surprised because she didn't realize anything was amiss. Further studies showed that she was deficient in iron, but she was eating a balanced diet. What happened? Hi, I'm Dr. Naznin Jamal, and I am a board-certified internal medicine physician here to empower you and educate you on basic medical diseases and concepts. So let's begin. Iron deficiency is more common than we realize. The World Health Organization states that 29.9% of all women between the ages of 15 and 49 are iron deficient. The value for children is even worse. Around 40% of children between the ages of 6 and 59 months are iron deficient. Iron can be found in two forms, heme and non-heme. The heme base is found in meats. The non-heme is found in fruits, vegetables, and legumes. Our body needs the iron. Our red blood cells use the iron to help them bind to oxygen to carry to our tissues and organs. When there's a reduction in iron, it compromises our ability to deliver oxygen to our body. Now, iron loss is basically caused by bleeding. When a red blood cell dies, that iron that it has is recycled and used again for new red blood cells. But if you bleed, you have a major reduction in your stores of iron. Now, symptoms of iron loss can include fatigue, lethargy, weakness, shortness of breath, changes in hair and nails, and in rare cases, a change in anxiety and maybe even causing depression. Now, iron deficiency in pregnancy can have later effects on the baby. How do we check for iron deficiency? The doctor is going to order a CBC, also known as a complete blood count. A CBC will tell you the numbers of white blood cells, red blood cells, and platelets, but it is the red blood cells that if they are reduced in the amount of their hemoglobin, that is when you call that an anemia. But there are multiple things that can cause anemia. To see if you're iron deficient, the doctor must order an iron panel, and through those studies can further evaluate if you have a deficiency in iron to cause your anemia. Now, the United States Preventive Services Task Force does not recommend that we screen every pregnant woman for iron deficiency because they didn't see any difference when that was done. But if you have these symptoms, you have to get screened. Remember, a lot of these symptoms can be caused by other diseases. And so if you're feeling this and you feel out of sorts and you just can't explain why you're reduced in energy, or maybe you have any mental changes, anxiety, depression, it's worth you having a conversation with your doctor and getting checked. CBCs are a part of your annual blood tests, and that is often the first time that anemias are first identified. Again, talk to your doctor if you have questions or concerns, and then we'll talk next time.